Welcome, everybody. My name is Dr. Kristin Castorino. I am an internist and a diabetologist at Sansum Diabetes Research Institute. I'm so happy to be here and so grateful that you all can take your time to be here. A little bit about this webinar. It will be an hour long, and we're going to try and cover as much as we can. I wanted to say a little bit about this town hall and why it's really important. This town hall was first started during the COVID pandemic for those particular needs about returning to school. But as you all know, returning to school, even without a pandemic, can be complex. And we want to make sure that everyone has the latest, greatest information and how to advocate for yourself and navigate all the ups and downs and challenges of school. It's important for you and your family to make decisions with the input of your own healthcare providers or healthcare team. Please do not take any of this information as medical advice, legal, health, or otherwise. Thank you so much. Now I want to move on and introduce our panelist speakers. I'm so thankful for you to all take time out of your day to be here. And I'd love for you, as I introduce you, to tell a little bit about your background. So we'll first start with Dr. Francine Kaufman.
Well, thanks, Kristin. My name is Fran Kaufman. I'm a pediatric endocrinologist at Children's Hospital Los Angeles and have been in the field for almost 4.5 decades. So I kind of get the longevity award. I've been doing this particular town hall since its inception, and really, really excited about helping you get your children back to school in as safe a manner as possible.
Thank you so much. And Dr. Cynthia Muñoz, thank you so much for being here.
Hi, thanks for having me. So I work here at Children's Hospital Los Angeles as well with Dr. Kaufman. I am a pediatric psychologist, and I specialize in working with children with a variety of endocrine conditions, predominantly with diabetes. And I've been here for just over 2 decades. So I think it's incredibly important to participate in these conversations to ensure that we prepare everyone to return to school. And my focus, of course, is ensuring that we are also addressing the emotional and mental health needs for kids.
That is so incredibly important. And moving on to Dr. Henry Rodriguez.
Hello, everyone. Henry Rodriguez. I'm a pediatric endocrinologist like Dr. Kaufman. I am the clinical director here at our University of South Florida Diabetes and Endocrinology Center, and diabetes has really been the focus of my clinical and clinical research work. I've had the privilege for the last several years of being co-chair of the American Diabetes Association Safe at School Working Group, really trying to really assist families, healthcare providers, and school personnel to really make sure that that children with type 1 diabetes and diabetes in general are able to really benefit from all the opportunities that all other children do at school.
Thank you so much. And now I'd like to welcome Jennifer Sherman.
Thanks for having me. My name is Jennifer Sherman. I am a staff attorney at the American Diabetes Association in our legal advocacy program. I've been working for the ADA for about 2 years now, and I'm based in Washington, D.C. Within legal advocacy, our Safe at School campaign fights against discrimination for students in school and works to make sure the diabetes management needs of children are met so that they're healthy and safe and able to enjoy the same opportunity as their peers. We have a lot of resources to make back to school easier. You can find those at diabetes.org/safeatschool, which I would definitely recommend you check out after this program.
Thank you so much. All right, so let's jump into our questions. And as we go through this, I want to reassure the audience that we're recording this session. And so this recording will be available at the end. We'll be sending it out to attendees. So wanted to let you know all that. So our first question is to Fran, as as you most often like to be called. How can parents and or guardians effectively communicate with school staff, including teachers, nurses, administrators, about their child's diabetes management needs?
Well, thanks for that question. And let me just start out by saying, obviously, the goal is to have a very collaborative relationship with the school. It takes a lot of effort sometimes, but I think we can all admit that that would be the optimal situation in which your child could thrive in that school environment. So I think if we go back to the Safe at School principles, the first principle is that the school is involved with you. The second one is that there's trained individuals within the school to really help your child do the tasks that are required to manage diabetes. And the third is that if the child is somewhat independent, that that's allowed as well. So getting first order is your diabetes medical management plan. So you need to discuss with your healthcare providers what you would like to see, what your goals are for your child over the next school session. Be sure you're in concert with them. There may be, a little pushback. Maybe the healthcare provider isn't quite as assured as you might be that the child could be independent, or maybe it's reversed. But really need to work with that your healthcare provider team to work out the very detailed plan. And sometimes maybe it seems a little nitty-gritty, but it's really every detail needs to be codified for the school to really be able to effectuate that plan. So get that diabetes management plan. Be sure it's what you feel is appropriate with your healthcare provider. And then that needs to be transferred over to the school nurse, is really the point of entry. I'm in California. There's some schools that don't have a nurse. There's whole districts that share, a nurse with multiple schools. So getting that done as soon as possible and getting in front of the school nurse is really important. And then go over, this goes over everything, high and low glucose, what the symptoms are for your individual child, what the treatment should be, when do you expect these to occur? What is the overall regimen? Is it an AID system? Is it still multiple daily injections? Is there a CGM or not? All that needs to really be listed out. And then what you want done if a glucose is not in the range. What you want done if the glucose is in the range, but there's going to be a lot of physical activity that may impact on that glucose level, so that the school nurse can then disseminate through her individualized health plan for the child in school, disseminate who is going to do what in the school environment. There's levels of training, level 1, level 2, level 3, essentially saying everybody in the school needs to know that that child has diabetes and what that might look like from a high or low standpoint. And then you get to the level 3, but only a few specific individuals in the school are really going to effectuate that management plan. I think one of the most important issues is to be sure that training has occurred across the board, that the teacher or teachers your child are going to interact with are aware of what needs to be done, what to look for. And, once all those plans are in place, we may need to change them because therapy may change. And don't kind of imagine that one plan might last the whole year. It might need to be modified. And there's a couple of things I think you might want on that plan if you feel comfortable in making some dosage adjustments with your healthcare provider, that you could then, within certain parameters, be allowed to change those dosages, particularly the nutrition plan as well. That your child, if independent in some of these tasks and management issues, is independent, that they're allowed to really do the management that they feel possible. Now, the one confounder since all this started is CGM. So who's going to follow the CGM? Certainly, I hope most of you, if your child is at a CGM, that you're following along with them. And maybe if you're not doing it all the time, maybe at the beginning of the school year, just to be sure what's going on in school. Who in the school might want to or be able to or be, kind of convinced to follow as well, the teacher or the school nurse. We would like to encourage that as well, but sometimes there might be some pushback, some education that's required. But all this gets put into those plans. So the plan is a critical starting point and, really done with your healthcare provider and really done with your child specifically in mind. So I hope that helps answer that question.
Thank you so much. And we're going to talk a little bit more about that comprehensive diabetes management plan. But before we go in a deeper dive there, I wanted to ask a question to Dr. Muñoz about how, as we're thinking about these plans and going back to school, what do you think people should know about creating a supportive environment that helps the social emotional health of kids coming back to school?
What a great question. And I could probably take up a whole hour giving a full response, but I think there are a few takeaway points that I would want people to know. First of all, teamwork is key. And so the foundation of teamwork when we're talking about schools is communication. And we can accomplish this communication in many ways. One way can be introducing oneself to the teachers, to the administration, to the health staff, and, hi, we're going to be in your school this year, or I'm going to be in your class this year. I'll be coming to your office this year, whatever that is. And being able to put a face to a name. I know oftentimes parents will say, well, my child has a plan, but the school or the staff may or may not be aware that my child has a plan. And so that's where, again, the introductions can be really helpful because making a note of, and I have a plan. And in talking about the plans, from my perspective, I'm referring to the 504 plan, or for students receiving special education, that would be the IEP, since the health-related accommodations go in either one. So that's one way of communicating. It's a great way to start the year with that type of introduction. Another key way to make sure that there is communication around your child and their needs is to have that 504 plan meeting, or if it is time for your annual IEP meeting. And if you haven't had one of these, if you're at a new school, it's been some time and there have been major changes, it's a good opportunity to request a meeting so that you have representatives from the different constituents at your school, the teachers, coaches, administration, the health staff. And during these meetings, it's important to talk about what will help your child be successful in school. I really appreciated a comment by Sheila Hansen that I see where, she's commenting about mental health being, one of the most challenging parts about, and I would say life, but also life with diabetes. So, and Sheila, your daughter happens to be in middle school. Well, middle school is a tough time, in kids' lives, but really the challenges around just life, academics, and diabetes specifically can happen at any age. And so using that meeting time to talk about your child's needs, ways to support them, and to also help illustrate how life with, for example, type 1 diabetes really is this 24/7 or 25/8, lifestyle where it involves a lot of things, throughout the day, on top of all of the academic demands that, that kids have in school. Some of the resources that I think resources that I think can be helpful to create that supportive environment and tuning into the emotional needs for students are resources like those that you can find under I believe it's the training resources for schools. It's with the ADA Safe at School web pages. There you find a school guide that has comprehensive information. Also, there are specific pages dedicated to mental health and diabetes, and that information can also be helpful. I think we have all had situations where we talk with people who believe they understand diabetes, whether it's type 1 diabetes or type 2 in kids, but they may not have a complete picture. They may not have a real understanding of what toll life with diabetes can take on a child. And again, within the academic setting, we're just adding layers upon layers. And so having those conversations about all of the expectations on children, how we want children to live full lives, we want them to play and be with friends and to have, all of these opportunities. But in order to do that, we need to be aware of their emotional state and of ways that we can support them. So those would be a couple of the key points that I would offer just to start developing that supportive environment in the school setting.
Thank you so much. And now the next question is for Dr. Rodriguez. Can you give us advice on best practices for developing that comprehensive diabetes management plan?
Yeah, so, I think Fran did a wonderful job providing an overview and really made my job easier, I think, as a consequence. But it really is, I think it's parallels themes that you're going to hear throughout this hour. It really is communication, it's planning ahead, and it's teamwork. So we generally recommend that families make sure they have an appointment with their diabetes healthcare team in the late spring or early summer. Let me just re-emphasize here that what I don't think is in the best interest of students is, that day before school starts or the day of, sending that plan or that request for that plan from the provider, because I can guarantee you they're getting a lot more that same day, and it's a scramble, right? So it's the idea of kind of planning ahead. As Fran mentioned, it's not only reviewing that student's care plan, how they manage their diabetes, whether it's be a pump or continuous glucose monitor or a combination or what have you, reviewing that. And then, as she mentioned, a really critical piece of that is a discussion about what that student's level of independence is in terms of managing their diabetes. So we want students at school, they have an opportunity to really be guided by, it may not be a school nurse, it may be, an assistant there, but really guiding them in really mastering skills, managing their diabetes, and the ultimate goal is for them to be completely independent. So that's a key component. And really that diabetes medical management plan, I think there was a comment by, I think it's Angela Russell, that, does it need to be a standardized form? It can't be changed. That is contrary to what we really try to communicate. The American Diabetes Association Safe at School Working Group has put together a kind of template diabetes medical management plan. And I should mention that group got input from school nurses from around the country, pediatric endocrinologists, really all the stakeholders, in trying to come up with a plan that is malleable in such a way that it meets the needs of that student. So really a comprehensive, this is what needs to happen regarding that child's diabetes care at school. And it does provide, that plan should, again, address what their level of independence. Do they need supervision? In the case of a very young child, they may need all of their diabetes care provided by a school nurse or a designee. In the case of, an older adolescent who's in high school, they may be self-sufficient in terms of managing their diabetes. I will say that, certainly in my opinion, it is really important for the school to be aware of what that diabetes care plan is for that student, even if they're independent, in the event that there is an emergency, that the child either has a severe low blood sugar or high. I mean, I don't think it is fair to the school staff for them not to know. So that's really important. I think as Cynthia would certainly speak to, not every student is necessarily interested or wants to, shout from the hilltops that they have type 1 diabetes or diabetes in general. I think it's very important that that student working with their family, their parents, their guardians, and the healthcare team have that communication to what level of support they need. I should mention that that also could change over time, right? We have even some students who are very independent, but then, happen to have some other stresses in their life, and maybe, they need assistance. And so I think that needs to be, it's a living document. And regimens may change, levels of independence may change, needs for assistance may change, but it all really comes down to initially the diabetes medical management plan and conversations with the healthcare team, and then by extension, the school staff.
Henry, I really appreciate, when you were talking about the levels of independence and how they can, or the level of support that students need and how that can change over time. And you were offering some examples, which are absolutely spot on. One of the things that, I see also are children who have had diabetes for quite some time, and or these like adolescents or, young adults, where there's an assumption that they can be independent because they know what to do, or they should know what to do and they should be doing that thing. But we also know that that children with diabetes, people with diabetes of any age, can experience diabetes burnout when they're experiencing this feeling of just being sick and tired of the daily routine. They can experience diabetes distress, where the ins and outs of managing diabetes becomes distressful. And so in those cases, if you have a student who has more lived experience with diabetes and or is older chronologically, I think it's just important to consider that they may still require, a higher level of support than some may believe they do.
So Cynthia, I think goals for the student, really working together with the, staff, the teachers, the nurse, all the people involved in diabetes care is really important. And one of them is, I've certainly had patients over time where the child needs more supervision, and one of our goals would be to try to reduce that supervision, but it's needing, that person might transiently need something. And so setting goals, I think we all like to work towards goals, and it really kind of, I think, incentivizes the school personnel to, really be partners.
Mm-hmm.
Absolutely.
And, again, resources aren't equal, unfortunately, amongst all schools. And there's a comment in the chat regarding that. Again, we always strive to provide the best support for those students. And a friend, as you've mentioned, I mean, that should be a goal for every student. Mm-hmm. And I think it is incumbent upon us as providers, as parents, to advocate for those students. And if there aren't enough resources available, make your voices heard.
Right.
And that's a great segue. So on that note of making your voices heard, I think a key component of that is knowing the law. And so this is where I want to ask, so what is the law, Jennifer? Can you tell us about the federal laws that protect children with diabetes in the school setting, and if they're and how that affects state level laws?
Sure. So there are two main federal laws that provide legal protections to children with diabetes in the school setting. The first is the Americans with Disabilities Act, or ADA. The second is Section 504 of the Rehabilitation Act. The ADA and Section 504 are both anti-discrimination statutes, and they prohibit discrimination on the basis of disability. And diabetes is a disability because it's a physical impairment that substantially impacts the endocrine system. And in addition to endocrine function, caring for oneself, performing manual tasks, walking, seeing, speaking, learning, concentrating, and communicating are all examples of some of the major activities affected by diabetes that make it a disability. The rights under ADA and Section 504 are similar. However, for Section 504 to apply, the school must receive some sort of federal funding. Luckily, this is very common. Most schools receive some sort of federal funding. The ADA applies to all schools, regardless of funding, if you're in that very small percentage, except it does not apply to religious institutions. So if your school's run by a church, it may not apply. Under ADA and Section 504, schools have to provide reasonable modification and accommodations to policies and procedures and provide related aids and services so that students with diabetes are given an equal educational opportunity. Lack of funding or not enough resources is not an excuse for not providing these accommodations. So they can't use that as an excuse for not following these federal laws. Some examples of accommodations when I think all of our doctors have spoken about greatly, training staff to monitor blood glucose, administering insulin, recognizing high and low glucose, responding in an emergency. And this is not just maybe the teacher or school nurse that you might be thinking of, but a bus driver, a staff that's on a field trip, or someone that's coaching a sports team for the school. It also does mean, as Fran mentioned, that students with diabetes can self-manage their diabetes if they're capable of doing so. Obviously, that's a continuing conversation. And students with diabetes can fully participate in sports, extracurricular activities, and field trips. A parent doesn't have to be at those to take care of their child's diabetes, just for them to participate. I do also want to mention a third federal law that may be relevant to your child, and that's the Individuals with Disabilities Education Act, or IDEA. This is where the IEP plans come from. And the difference is that unlike ADA and Section 504, for your child to qualify under IDEA, they must have an impairment that impacts the ability to learn. So often we see a child with diabetes who also has another learning disability that might make them need an IEP. So just keep that in mind when you're trying to decide which plan is right for your child. States also have relevant laws which can impact especially who can administer insulin or glucagon in schools. We've done a great work to make it so that in a lot of states, it doesn't have to be a nurse. For example, in California, there's trained non-nurse staff can administer insulin, while in New York, it still requires nurses to administer insulin. I'd recommend checking out what your state's laws are if you're getting some pushback from your school on who can or cannot administer insulin on the ADA Safe at School website under legal protections, which Crystal just put in the chat, so thank you.
Yeah, and that's a great, great time. If you're not watching the chat, please open your chat button, and there's a lot of wonderful links. And I also want to reassure everybody that we will send the links out to all the attendees or anyone who RSVP'd, so you'll have the access to this information at a later time. Now I'd like to ask Dr. Kaufman and our other panelists for what's your advice or for when you are getting pushback, when a school is saying, well, we don't have the resources for that accommodation. What is your advice on how to navigate that?
Well, maybe I'll just start it off quickly. And Cynthia already brought this up. Obviously, the first one is communicate, followed by educate, followed by negotiate. When worst case scenario, you can involve maybe Jennifer and get litigate and then legislate. I spent some of my early years as a pediatric endocrinologist going back and forth to Sacramento to be able to pass that law in California to have a non-licensed individual be able to administer insulin. So it takes time. I'm not saying it's, an easy pathway, but the first is really communicate. And I think that part with educate at the same time of maybe it's the first time that the school nurse and some of the administrators at the school have had a child with type 1 diabetes. And maybe they're not necessarily aware of what needs to be done and what is already kind of guaranteed for that student. And I agree. I've heard a lot of times, well, we don't have enough resources. That's not your problem. They have to find the resources. They're obligated under federal law to give that child an environment in which they can be educated equivalent to every other child in the school. So, it takes time. I'm saying it's not easy. I know I saw in the chat from someone that sometimes the healthcare providers aren't really aligned on your side. Maybe they're aligned more on the school side. I think you really need to, confront your healthcare provider with, this is what our goals are. This is what we would like. Help me understand why you're not supporting us. And educate them too. Maybe they feel we're asking the school too much. Well, if that's what you need for your child to be safe, that's what you're able to ask for.
And Fran, if I may, I think you made a really good point, and as did Cynthia, to start off with the communication piece, right? I think as we all kind of navigate things through our lives, we realize that, confrontation many times isn't the first thing you want to do. So, in your listing of kind of the approach, you didn't put litigate at the top.
Right.
So I think really approaching the school to say, perhaps to a school nurse that has really the best intentions, but doesn't have those resources, to say, well, these are resources that are available to you. I can assist in, educating you on my particular child's needs. Perhaps there are local resources in the community, a medical center, diabetes center, and have you. But really approach the school, and I'm speaking to the parents in this case, with, I'm prepared to help you, right? And this is what my child needs, as opposed to, going in there saying, I have an attorney and this is all the things that you're required to do. Yeah, at the end of the day, if your needs aren't being addressed, that may be, that certainly is an option, but it's not the first option. And then again, hopefully you've got a supportive diabetes healthcare team that will assist in providing not only that direction in terms of the diabetes medical management plan, but resources to educate the folks at this school.
Yeah, and this is where I would, highlight again the importance of these either meetings to develop a 504 plan or review and update the 504 plan, or if your child has an IEP, to call a meeting together to review and discuss the plan, because there are many resources available through schools and through school districts, but not everyone is always knowledgeable about what is available. I know that might sound terrible, but many of us, we work in large organizations, and we may not, be aware of everything that's available. By having a team together, representatives of those key individuals in your child's school life present, and having a conversation, that can also be helpful. And yeah, presenting information in a tone of collaboration. This is complicated. I'm committed to working together, with everyone here. When it comes to mental health, emotional well-being, I was reading some of the comments, and just, some of that does require education, because you as a parent or guardian are going to be the expert on your child. And so having those conversations to develop a plan, to identify the needs, but also to then, figure out what resources can be available, is all going to be really important. I think we're going to get into some of the specifics of some of the other questions and comments that are made around, these topics that we're commenting on. So I'll save some of that, but I think we're going to come back around to communication, time and time again, because it's just so critical, and we get everybody so busy. It's not always fun, but it really does make a difference.
Thank you so much. And I think I think one of the consequences of after the pandemic is there's just been a lot of change and a lot of people changing jobs and people in new positions. And so ever more important to communicate. I like that. So now changing gears just a little bit. Cynthia, this question's for you. What are the common psychosocial challenges that kids with diabetes experience at school? And maybe also, what are the ones that we should be talking about?
Oh my goodness. Great question. So one of the things that we know through a lot of research that's been done is that people with diabetes, including children with diabetes, are at greater risk for symptoms of depression, anxiety, in addition to some of the diabetes specific challenges. I mentioned a couple earlier: diabetes burnout, diabetes distress, and so having knowledge about a child and whether they are struggling with any of these things. And they may not always be so obvious. Sometimes we can tell when a child's grades change. Maybe they were, really good students, or they were solid, stable performing students, and then now they're struggling. It could be that something academically has changed. It could be that something has changed, mentally and emotionally, and that's an opportunity to intervene. Um, we can also look out for behavior and whether they're interacting. Maybe they seem more agitated, more irritated. Certainly, some of that can be more common in certain developmental stages, pre-adolescence, adolescence. But having an awareness for these changes gives an opportunity to have important conversations with the school team. So we've talked about talking with like the whole 504 team or the whole IEP team, but there are a couple of people at schools that can be really, really important for you to be aware of and to include in these meetings. And those are school psychologists. Some schools have clinical social workers, or they call them psychiatric social workers, or they have other type of mental health counselors. And so having conversations with these individuals can be the first step. One of the comments had to do with a child that is experiencing difficulties emotionally, but the team perhaps is trying to figure out, is it emotional or is it the diabetes, where it could be, yes, it could be both. And so how do we know that? I mean, that's probably that's complicated to figure out, what is it, which one is it, but involving the school mental health team members can be really helpful to start to really, figure out, what is happening. And then the supports and, bullying and teasing around diabetes is just it, I'm grateful for the schools that have just zero, tolerance, policies, because teasing and bullying just it damages the soul. It damages people emotionally, and that damage is not easily undone. Life with diabetes is difficult enough, and then to be a child and to be teased and bullied about it, can simply make it so much more difficult. So communicating those things to school staff. So for students and kids, creating those, open channels of communication so that they can communicate those either to you as a parent or guardian, or communicate that to their counselors or their nurses at school, teachers, whomever they feel comfortable talking with. And then pulling in the individuals at the school level who can support with addressing the teasing and the bullying. But in the case that emotional support is needed for a student, schools have varying levels of emotional support available, and it really does differ by districts and certainly by schools and in some of the very small districts. I'll give an example here in Los Angeles, and we have what's called DIS counseling. And so that's one level of therapy or emotional support that's been given in the school. Parent signs a form giving permission for the child to receive that. There are also higher levels of support for children, for example, that have an IEP. If issues around diabetes or health or mental health are impacting their learning, then they may be eligible for these types of services under, I believe Jennifer mentioned learning disabilities. And in this case, maybe it's going to be under other health impairment, maybe it's going to be under emotional disturbance. Not the nicest sounding labels, but they're categories, and they can be helpful to get these additional levels of support. So I mentioned DIS counseling. The higher levels of support, for example, in this area would be what's called ERICS or ERMS, and that's educationally related mental health services. And so there are processes for obtaining these services. With some, it can be as simple as signing a form to give permission. And in other cases, for these higher levels of support, it may require an assessment. If your child has a community-based mental health clinician or therapist, sometimes their input can be really helpful to make the connection between how their learning is impacted by their emotional status or well-being, and then supports can be identified and provided. I'm a huge proponent, last comment on this topic, of support services within the school. In addition to support services that may be received outside of the school. And the reason is that support services at the school are focused on learning and accessing education, as opposed to community-based services, which may be broader and maybe tackling issues that are related to other parts of a child's life, not just school.
Thank you so much. That's so much dense information here. I think we could all listen to this like 3 times over and keep getting pearls of wisdom. Time is flying by. I wanted to ask Jennifer, if you can just go over what is a 504 and IEP, and how do you get that process initiated?
Sure. So a 504 plan is what outlines the accommodations that your child's going to receive in school. It integrates the DMMP into like how it's really going to be done in the school setting. Schools are supposed to identify children with disabilities who may need a 504 plan or IEP, but in practice, we don't see that happening soon enough. So we recommend that the parent or guardian of the child request a 504 plan because your school might not be on top of it. You should definitely do this in writing so they have, it's obvious that you're requesting it. And I think we've already touched on this. After notifying the school, the process should be collaborative. You're going to work with your child's healthcare provider to create the DMMP. This can then be transmitted to the school, which will build the 504 plan. And again, these are individualized documents. They should not be giving the same DMMP and same 504 plan for every student with diabetes in that school. It has to be individualized to the child. Make sure it's as specific as possible. It includes all accommodations your child may need. The most recent one that we're seeing as of late is including smartphone access for CGM monitoring. So please be sure to include that in your 504 plan. And finally, again, we've discussed this a little bit. There should be a meeting to discuss the 504 plan before it's finalized. And this is a great place to advocate for your child and make sure that all the accommodations are included in the plan. Again, the earlier you get all this done, the better it is to ensure that everything is in place at the start of the school year. I know it might be a little late now since we're already into August to get it done before, but you can always think of next year, starting this process even as early as the spring to prepare for the next school year. Yeah, I think that pretty much covers it.
Okay. And so for For those out there that haven't started the process yet, what would our panelists recommend for families that, of course, they're going to plan for revisiting this process in the spring, but what's some advice on what to do if school is starting next week?
I'd still say go ahead and get your DMMP as the initial document that all else flows from, the individual health plan that the nurse will develop, the 504, so everybody sees the diagnosis, understands the treatment plan. And, you know, it's a lengthy document. It takes time from your healthcare provider. And I think Henry put it probably best. If, you know, we get 25 of those the day before school starts, you can guarantee you're not going to have one on the day the school starts. So, you know, as soon as you could do it, go ahead and do it. And then be sure that your healthcare provider, as they're filling it out, it's a collaborative effort between you as the parents and your healthcare team. And this is where, you know, really kind of supporting, communicating, educating, whatever words we want to have to get your healthcare provider on the right side of your case. You know, I know we're not always the easiest people to deal with. You know, we are human. And some of them really perhaps don't understand the full impact of not having an appropriate DMMP. So it's a lot of education, you know, and refer them. I throughout all these years, I've referred people to Crystal when things get bad.
I guess I would,
or even good, Crystal.
yeah. The other thing that I think is critical to allowing kids with diabetes to thrive at school, we've got all these plans in place. Let's not forget supplies, right? So you have even if you have somebody who's on the latest technology, a hybrid closed loop system, that's, you know, they've got a continuous glucose monitor, they've got their insulin pump and so forth. I'm generally one that advocates we don't want surprises, we don't want emergencies. And so that includes, you know, things like certainly having glucagon available, but making sure that you've got a blood glucose meter in case that continuous glucose monitor fails, with test strips and Lancets, that they've got, you know, an alternate insulin delivery system, a pen or a syringe and vial, so that, you know, if that student arrives at school at, you know, at 8:30 a.m., something happens, whatever, they didn't charge their pump or something, that they have a backup plan. So it's not, you know, chaos and all of a sudden you've got to get a clip, you know, their parent needs to come pick them up, or God forbid, some schools we've even heard they're going to call 911, you know, crazy things like that. Just making sure that that plan is in place and the appropriate supplies are available, I think, is critical.
Yeah, absolutely. And aside from you know, having the plans and the supplies in place, you know, on the mental health perspective, there was a question about whether information pertaining to mental health or emotional well-being can be included in 504 plans. So what I would say is that yes, you can include information, but I would argue that all of the accommodations related to health are going to promote improved, you know, emotional well-being around health management, diabetes management at school. And so it can be really important for children who have an awareness. So maybe not the younger ones, but to let, you know, your children know what is in their plan, so they are aware of what their accommodations are. Also thinking about some children who, as Henry mentioned earlier, that I would say, and I absolutely, the kids who are either discreet with their diabetes and they're not the ones shouting from the mountaintop, or kids that tend to be more shy or have anxieties. And so also thinking through creative nonverbal ways of prompting these kids to manage their health. So some of the tools that can be very helpful that can be included in plans, of course, discuss these things when you have your team meetings, are things like a medical pass. And so this way, if a child is outside of the classroom, either going to the restroom or going to the health office, wherever it may be, or they're leaving leaving, because they have a medical appointment that day, having that medical pass so they can just show it to indicate, there's a reason why I'm out here outside of my classroom. And then there are other strategies of using different cards of different colors that kids can put on their desk or hand over to an aide or a teacher that tells the aide or teacher where the student is going. So there are just many different ways, and those can all be very helpful. There are more specific accommodations, and this is where I would suggest having conversations with the mental health professionals at school settings, in your clinics, your diabetes care teams, if there are mental health professionals who are part of those teams, and or therapists that you are working with in the community, in really knowing what your child's needs are. That's when you can work together to make sure that you're including those types of supports.
Wonderful. Thanks so much. We're seeing one of the hot topics is CGM, whether it's CGM, the phone that's actually so you can see the data or see the glucose numbers, or who's following CGM. I wanted to talk a little bit about that. So I'm not sure. I bet everyone's got some opinions about CGM. So Fran, do you want to go first, and then we'll go through and get everyone's take on CGM as we advocate for kids returning to school.
Yeah, well, CGM is one of those things that I don't think we can live without anymore. It is a singular improvement in how we can help manage diabetes with the information that becomes available. I know how important it is for parents to follow CGM. That older teen, the young adult, it's maybe a little bit of a different story, but certainly for the younger children, having that assurance that nothing's going to happen that you're not necessarily aware about is really important. I think for parental peace of mind, of course, parental peace of mind helps improve child peace of mind. And that feeling that I am safe, I can go away from my parents and still be safe. So it's critical for the parents to have it, which means the kid has to have their phone. And then if there are individuals inside the school who will follow, I mean, I have some schools where the teacher is following, the nurse is following, the principal is following, that may be more people than we need. But if there's a way through communication and education, way before we get through to litigation, to encourage at least the school nurse to follow, I think it can make a huge difference for the child. Now, some kids are incredibly stable. Maybe it's not as important, but then there's always, the illness, the change in activity, the change in food. I do have one family that feels, oh, we're doing so well, we don't need anybody to follow. There's always, as Henry suggested, an emergency, and you want to be prepared for that. So if possible, I think it is a big advantage.
And I would add, as we've heard time and time again, communication is critical. So expectations. So if you have individuals, and I absolutely agree, CGM, I'm a fan, right? I've said it. I think it's critically important, not only in terms of safety, but quite honestly, as someone who prescribes insulin, I think since patients have been using CGM, it allows me to feel more comfortable being aggressive and trying to get those patients to target safely. So I think following communication, again, is critical in terms of, okay, well, what's the agreement here? At what point does a parent perhaps contact the school nurse because they're seeing a level of X, right? So I think to the point where that diabetes medical management plan and the subsequent 504 and IEPs, there needs to be very clear expectations as to who is responsible, what communication is going to occur, so that at the parents' level, they're not feeling anxious that, gosh, I'm looking at this trend and nobody's doing anything about it. That on the school nurses and school personnel's perspective, they don't feel that they're going to be getting an inordinate number of calls from the family. Again, I think expectations are really, really important here in making everybody feel confident that that student is going to be safe and they're not going to be, as one comment was mentioned, lots of alarms going off. It's really important that you look at those settings. And there are some settings that we definitely want an alarm to go off, other settings where it could be subtle. Cynthia, as you mentioned, having perhaps non-verbal cues between that student and their teacher, just really looking at those scenarios and trying to really be as proactive as we can in terms of planning ahead.
Yeah, absolutely. And CGMs from a mental health perspective are critical as well, from my perspective, because it can also help monitor and potentially ensure safety from a mental health perspective. And so this is also broader conversation about diabetes technology and how it can be very helpful and in some cases critically beneficial for mental health safety, being able to monitor. Along this topic, Jennifer, I have a quick question for you. I know parents sometimes bring up about devices, right? Having their smartphones. But for example, you have students who take like SAT exams and there are different rules where accommodations have to be requested, separately, but a 504 plan, for example, can be used to support the need for those accommodations. What are your thoughts on including something specific about having the cell phone or the device within 10 to 20 feet, or I've read, different things, but having it within the indicated distance of the child or the technology so that it works properly?
That is a great idea and definitely should be something that can be requested in an accommodations plan for standardized testing. Those processes are going to differ whether, it's ACT or SAT testing, if they're going to law school, those sort of tests, medical school, those tests, the processes differ, but we definitely think that it's a reasonable accommodation to have that cell phone or smart device within 20 feet of the student or whatever the range is. And that can be customized in a doctor letter if it's not specifically already on their 504 plan for that student. And we definitely see that as growing and being more common. We had seen initially maybe some pushback from these testing entities, but now they're okay with it as a solution to make sure that these students are safe when they're doing these standardized tests.
Could I just add something? When we talk about all the technology we've added and all the new therapeutics, so I did a study in the late 1980s when we couldn't actually successfully get LA Unified School District to allow children to be at school with an insulin pump. So we had the use of insulin pump at nighttime only. So the kids would use the pump at night. In the morning, they'd have to take intermediate acting insulin and regular, for those who remember. Do that during the day. Then they come home from school, they could put their insulin pump on again. And then we went through, Crystal was there, lots of us were there at the time, so many different iterations of what should be allowed in the school through, again, as Henry says and Cynthia says, communication. So we're at a point where now we've got automated insulin delivery systems that so many children are using, cell phones and pumps. We've come a long way. We've brought the school a long way with us. We've brought all of you a long way with us. We're not at the end of this road yet, but I think we should all feel pretty encouraged. And for those who aren't getting exactly what they needed, maybe even more encouraged that we can get everybody up to where they should be. Now, if we can do it for some, we ought to be able to do it for everybody.
That brings both hope and nostalgia all in one. As we're wrapping up the hour, I just wanted to ask our panelists if there are any other final comments that anyone wanted to make before we close this meeting.
I just have one quick comment on the cell phone ban legislation and policy that we're just seeing pop up in school districts around the country. I want to let everyone know that we are monitoring this and we're making sure that there's medical exceptions in these policies for students with diabetes, as well as other medical conditions that might require cell phone use. So please make sure that smartphone access is on your child's 504 plan if they use a CGM or need it for any other device. And if your school district has such a policy that doesn't have a medical exception, or if they're getting resistance even with the medical exception, please call us at 1-800-DIABETES. We want to help you and make sure that this isn't an impediment for using these great technologies in school.
And I would just add, as I've mentioned before, Fran listed kind of the steps of getting what you need. But I think, as I think we all agree, communication, collaboration, and really having expectations so that, again, everybody knows what is expected of them in providing that paramount care, that important care that students need to allow them to thrive at school.
Yeah, communication is something we've mentioned so many times, and effective communication, again, it's not always as easy as it should be. So one thing that I would put out there for parents and guardians is that, the way that you communicate and advocate is really important, not just to, have your child's needs met, but it's important for your child because, kids learn from all of us. Kids are watching, they're listening, and so it is an opportunity for them to also learn how to advocate for themselves and others as they get older. So with chains of command, starting with the person with whom there is an issue, or where there is, in charge of the thing that you have a question about. So if it's with a 504 plan, there are 504 plan coordinators, or is it an administrator who's the person that you should go to? And then, there are other individuals. There's always, the school level, the school district level, as has been mentioned, 1-800-DIABETES. By the time you're dialing or looking for the number for the S, it's already ringing. And so the amazing Safe at School staff at the American Diabetes Association is wonderful. I know that I stepped out of a 504 meeting at school and called 1-800, and thankfully someone answered and was able to really help on the spot. But but really there are people that are wanting to help, and we don't want people to reinvent wheels. We're all here because we want to be supportive. We want to help others learn the things that we've all learned over the years. We also want to learn from you, and that's where I really appreciate that there is a place, there are people that you can bring your concerns to. Please do that, because it only helps us all do better.
Well, thank you so much. We've talked a lot about communication, and another C word that's popping to mind is community, and how powerful it is to have this wonderful community. So I want to thank the ADA and Breakthrough T1D, Sansum Diabetes Research Institute, and our incredible panelists. Thank you all so much, and our wonderful community who are attending. Your wonderful questions. Technology is constantly changing, our world is changing, and through communication, community, planning ahead, and teamwork, we can address all the challenges day by day. So with that, I thank you all so much for attending, and a reminder that we recorded this session, and we'll be sending out this recording so it's available, and then we'll also send links that we've had in our chat. So all this information will be available in a couple of places. Thank you all so much, and I wish you a wonderful 2024-2025 school year. Bye, everybody.
Take care, everyone. Good luck.
Hey, everyone.
Bye.